So welcome everyone to our Corners Outreach Health Series. We get the opportunity to do a session in English here, and we're grateful to Dr. Paulina, who has joined us with her expertise in infectious diseases. She's originally from Mexico City, but has completed multiple degrees here in Georgia at Emory, and is currently working at Grady Hospital. So Paulina, welcome. Thanks for joining us. And maybe you can tell us a little bit more about your background.
So thank you very much, KC, for having me today, and welcome everyone. It's a pleasure to be with you and share information and answer any questions that you may have around COVID. And so my name is Paulina Rebolledo, and I'm, as Casey mentioned, I'm originally from Mexico. I was born and raised there pretty much all my life, and then I came to the U.S. after completing medical school, and I did my training in internal medicine, so just in general, general medicine, and then did infectious diseases all at Emory. And I also did a master's where I worked with disadvantaged populations, primarily concentrated in HIV. And my research has primarily been focused on trying to understand how certain childhood immunizations function in kids with malnutrition in Latin America. But since the start of COVID, as an infectious disease doctor and also a microbiologist, a lot of my attention and my research has focused on or has turned over to COVID, from trying to find treatments to getting tests up and running and reaching a lot of the populations. As well as now with upcoming vaccine studies in humans. So thank you again for having me.
Yeah, no, we're just grateful to have someone with your experience, both in the scientific study side, but also you're seeing things every day that we just get to see on the news, and so you're really on the front lines. And so we're glad that you've taken some time here to share some of that knowledge and your expertise with us. So we've had a few questions come from some of our program parents. Obviously, we've had a lot of different questions throughout since March, when this really all kind of came to light here. But I think some of the questions have evolved as time's gone on and as we learn different things. And so I was really impressed with some of the questions, but we'll just kick it off here. The first question, what are the current trends with testing, but also with infection rates, both locally here in the Metro Atlanta area, in Georgia, and in the U.S. as a whole?
So in the U.S. as a whole, currently we're at around 5 million cases and about 160-something thousand deaths. Georgia is one of the states that continues to have an alarming increase in cases as well as deaths as we look at them week by week. And so Georgia is currently around 241,000 cases with close to 5,000 deaths. There's the number of tests that are being done in Georgia as a state continues to improve, but we're still not doing as many tests as we need to really know, what the overall positivity, meaning how many people have test positive for the presence of the virus. And that also is particularly important because the areas that tend to have the higher concentration of areas where one can get tested, or that it's easier to get tested, tend to be in the city. And so as we go out more into the rural areas, or I guess counties that we term testing deserts, meaning that it's really hard to get a testing, there may be a very, very limited amount. So it may look like there's not a lot of positive tests, but that just may be, artificially down. And so where we currently stand as a state in terms of the percent number of positive cases, we're around 10%, 10 to 11%. And that has certainly come down to where we were a few weeks ago or like the middle of July, but it's still higher than the national average. And it's certainly higher than what is recommended for one to be able to start to do opening up on a state level. So like adding those layers of, opening restaurants, opening bars, and certainly going back to school. The recommended, or what the World Health Organization recommends, is that we should be under 5% in order to start to think about it. So we're basically double that recommendation.
So that 10% means that for every 10 tests that are administered in Georgia, there's one person who tests positive. Is that what that means?
Exactly.
Okay.
That takes into account only, if I get tested 4 times, they will only count my positive test 1 time. So I get it for each individual, like when they test positive, but that's exactly it. And so if we think about that for every 1 out of 10 people that test positive, then obviously, they have the ability to infect additional people if they're not tested in a timely manner and self-isolated at home.
Uh-huh. And so with that, when would you recommend getting tested? For our families here, like what would you say would be a good, like, I guess, recommendation on when to go get a test?
So that's a really important question, and the answer is it depends. If you I think there's two different ways that the virus can affect us, and one is making us ill. And so having symptoms that we've all heard about is having like fever, body aches, loss of smell, loss of taste, headache, diarrhea, just overall not feeling well. And so whenever one is feeling sick, then you should get tested at that point. But there's a lot of other people who can have, and that particularly applies to children or younger adults, is that they can still have the presence of the virus and not necessarily feel sick at all. Mm-hmm. And so it is recommended, especially as children are going back to school, or if they are going to go back to school, that they get tested even if they don't have any symptoms. So I would say that everybody should get tested as they're starting, if they are going to specifically start to go back to like school, or needing to like go back to work, or certain some of those like scenarios. And then there's also the third situation, which is if I am in contact with somebody who ends up being positive for the virus, then it may be worth it to wait at least 2 to 3 days before I get tested. Because if I get tested like that same day that I found out that I was in touch, that I was close to that person, then the test may still be negative, not necessarily because I don't have the virus, but because it takes a little bit of time for the virus to sort of have enough presence in our bodies for the test to be able to detect that it's there.
Yeah. Okay. Yeah. I didn't know that. So that's really good to know. And that actually goes into the second question, because most of the families we work with, at least at our location, are in Gwinnett County, and so Gwinnett County schools will be going back, or they have the option to go back for in-person school starting next Wednesday for kindergarten and first grade, 6th grade, and 9th grade. So all of the lowest grades at elementary, middle, and high school. And so the question here is, what can I do to keep my children and family safe with the return of in-person school?
So, the return to school is obviously like a very important aspect of, child's development, as well as, the ability for parents to continue to work, and even if they're working from home. And it's really, there's no easy answer, and there's no, strict recommendation of like, this is the correct way to do it. It's one of those things that, like, as with everything with COVID, it's a very dynamic and very fluid situation. So it has to be sort of, in a way tested out, and then maybe it needs to be revised. But there are certain things that we know, and that, based on the learning from the Chinese experience and the South Korea, as well as Europe, and that is that having systems where a limited number of children start to sort of like, even if they're going back to school, keeping them in certain pods or limiting the number of children and keeping them always with the same type of, the same group of children, as well as with the same teacher, certainly can have I guess an important impact on limiting the spread of infection, and the use of masks. So the use of masks is very important, and I think, in our opinion, in the infectious disease world and scientific, it should be something that should be heavily, parents should be counseled on having their children wear masks. And even with the little ones, I have a 4-year-old son, and I think we've been trying to, since the beginning, he sees us wear masks, and we make it something that it's just something that we're adapting, and he has like different masks, and just making it something that he sees that we wear them. So trying to normalize it, so that then when they and practicing at home so that they wear them, and children can surprise us, and I think they're probably a lot better than many adults in being able to wear masks. But I think that's one of the things that we can certainly try to role model our children around, and then as well trying to enforce like hand hygiene and hand washing in the schools. And so I think there's a lot of limitations with certain schools, that some of them are not necessarily equipped, or they don't have enough hand washing stations. But I think some of those things they're trying to optimize with the resources that are available is very important, as well as, again, trying to, as much as possible, for example, for certain activities where kids are used to touching the same things, or like using the same, arts and crafts. So finding ways to try to limit that direct contact with a lot of the materials, and then, practicing social distancing as much as possible.
Yeah. Okay. Yeah. Those sound like, the guidelines that we've heard, and it's just a matter of sticking to it. And like you said, normalizing it and making sure that the kids see that the adults are also doing those same things. So in terms of, we know that the Gwinnett County Schools is taking, those kinds of measures to make sure that the kids are safe when they're at school. When the kids come home off the bus and they get home, are there any certain things, should they wash their hands immediately? What should they do with their mask? What should the kids do as they come home from school?
Yeah, so great question. So, once they get back home, they should certainly wash their hands with soap and water, for 20 seconds, teach them a song. They all I think they're very good at they probably can teach us a lot about proper hand hygiene. And then the mask is usually recommended, that depending on, usually kids are ideally they will be wearing, or not ideally, but more likely they will be wearing a cloth mask made out of fabric. So those, they can be washed pretty much just in the regular washing machine with hot water. And it's always nice to have at least two masks on hand, so that one day they use the other one and then they wash it, so that they should, remove that and wash, as well as any other things, particularly, even though we recommend and we try to enforce as much as possible that kids don't share obviously the same water bottle or touch some of their lunch boxes, but some of those things are good to sort of wipe them down and just wash them routinely. I don't think you necessarily need to wipe them down with alcohol or anything like that. It's just more washing them with hot water when they come home, and then just hand hygiene as important as well.
Okay. Yeah. So you'd recommend washing that mask after that, just after each day, then?
Yeah, because I think a lot of it is, the idea with the mask is that we should, in addition to wearing it properly, we should not be touching the mask. But sometimes with kids, it's a little bit harder. And I think, again, we can teach them and role model them, but, with certain things, they'll have to remove them. And so that's sort of touching of the continuous touching throughout the day. It's just something to, when they come home, just take it off and then wash it and have an extra one for the following day.
Yeah. All right. Perfect. Thank you.
And then one thing more, and we may touch on this a little bit later, but since it's relevant as well, is when they come home. So a lot of it has to do, as you were mentioning, in a way, it may be able to be more controlled in the school environment with some of these measures. But the other thing that's really important is for all of us, that when our kids come home, if they are going back face to face, the things that we can do when they're at home to keep them safe and to keep our community safe. And so that is, again, trying to limit who they're in contact with. And, obviously kids need to socialize, and they need to play, they need to be outside, but trying to, as much as possible, and even though right now, the weather is very muggy and it's extremely hot, it's always better to try to do something outside as opposed to being indoors, in terms of the ability for the virus to spread. But the other thing is that trying to limit the amount of people or other kids that they're playing with, and if they are playing with other kids, more creating this concept of social bubbles. So meaning trying to play with the same families, but so that we can all sort of be the same ones to be around each other, and avoid each family congregating with 10 other families. So maybe each family picks 2 families or 1 family, and trying to limit the amount of gatherings to under 10 people.
Okay. Yeah, I feel like that really makes sense, because you think if there's 1,000 kids who go to school, and then they all go home and they all interact with 2 different families versus 10 families, the number of people they've all interacted with, and then they come back together the next day at school, if everyone who goes home just interacts with whoever they want, it's a lot more likely that someone will get infected. But if people are responsible at home, it also protects them at school.
Exactly. Yeah, exactly. Oh. And then just trying to, again, even with when they do, if they see one other family or a group of a small group of kids, the same thing should try to be practiced, meaning that trying to be outside as much as possible, just because obviously there's a lot more circulation, and we know that stagnant air and being indoors just helps with transmission of the virus. So as much as possible, having that be done outside. And I know it's really challenging to wear a mask when you're outside, especially because of the heat and the humidity. But it's, also trying to if there's a way that you could either limit, again, the social distancing while doing outdoor activities, and then trying to play at hours where it's more towards the end of the latter part of the afternoon, and then just, if you are outside not wearing a mask, trying to be those 6 feet apart.
Gotcha. Yeah. So I all the advice and recommendations that you just gave basically answers the next question, which says, we're looking to start our after-school program next month here in our Jimmy Carter location. We're hoping to have teachers with small groups, but what you've just said is just limiting the kids going by each other in the rooms, or keeping it, this group of 5 students will always be with this teacher in this room, and they exit out this door. Are there any other recommendations as to how we can safely meet with our after school program?
I think the other important thing is, because schools tend to be, and just in general, public venues or public places tend to, they tend to have a lot of areas that people touch. So trying to kind of disinfect all of those high surface areas. And even though the virus is not necessarily, the main form of transmission is not thought to be through contact with surface, it is if you're touching a doorknob that could have potentially been touched by somebody that sneezed and had the virus, and then I come and touch it and touch my face. So I think those high surface or high contact surfaces, or doorknobs, tables, those areas where children tend to play, keeping those areas clean is also very important, and obviously emphasizing a lot to parents and families that if your kids, if they're having any symptoms, any sort of not feeling well, to always err on the side of caution now, and thinking about you want to obviously keep your kids safe, but you also want to keep everybody, because it just sort of feeds into the same circle of keeping the community safe and all of us caring about each other and for each other.
Yeah, I think for me, that's been maybe the biggest takeaway from this whole pandemic, is that my actions immediately affect the people around me. And, obviously the people I interact with more, it affects them more, but also just, my actions in the grocery store, just passing people, if I'm doing my part to wear a mask and stay home when I'm sick, that's taking care of me, but it's also taking care of other people. And so we actually had our summer camp, a very modified, small version of a summer camp where kids came and got tutoring with a small group with a teacher, and we had the parents sign a form to say, if your child is feeling sick at all, please let us know and keep them home. And we were really nervous to see if the parents would oh no, I just want to get rid of my kids. It's like they're not that sick, just tough it out. But thankfully, there was only one kid who had a minor little cold, and the parents kept him home all week. They went to the doctor. The doctor said, yep, it's just a cold, but they still stayed home for that week. And so that just made me feel a lot more comfortable knowing that our families understood just how much this can affect everyone. So that goes along really well with what you just said. All right, so going into, you mentioned a little bit some of the activities and things that can make our activities safer by keeping a smaller social bubble and also being outside. So what kind of activities would you recommend, or types of activities that would be maybe safer than others?
So I think, anything that's outdoors, so that in a way, that children can play together, but not necessarily, a lot of the high contact sports, those probably right now are not the best idea. So more things like for kids to just sort of run around or ride their bikes, but not necessarily that they're all maybe playing soccer or playing a lot of the very high contact sports, those, because there's a lot of, it's really hard also to wear a mask with those. And there's just a lot of body contact, and there may be interchange of body fluids, like people coughing or people spitting, or a lot of that may increase the risks. So more trying to limit to sort of activities that they play together, but they're in their own confined space. And then obviously going, for walks or just playing outside, or there can be, kind of in areas where if it's a small number of children, where they could, play outside with kind of in a way sprinklers or stuff like that, as long as, again, there's just sort of more spread out and not necessarily, I get asked this question a lot about is it safe to go to the pool? And it's not so much that you're going to get the virus because you're going to get it from the pool itself or the water in the pool. It's more that if there's a lot of people in the pool, then that obviously defeats the whole purpose of us being outside. It's just, think about and the same thing applies to the beach. If you're on a beach by yourself or with another family, then that's very different. That if you go to the beach and there's thousands of people around you and everybody's just sort of in each other's space. So again, just keeping an eye on about with regards to your surroundings, and that's probably go to parks at not peak hours, or try to find green spaces that are not not congregated by a lot of people, so that you could still do those fun activities, but be socially responsible.
Yeah, well, that's good advice. It's not necessarily any activity that is bad or good. It's just the amount of people there. So what about would you recommend eating inside at a restaurant?
So right now, based on overall the numbers, how they look in Georgia, our recommendation, which I know may not be necessarily what our political leaders may say, but it is to try to avoid particularly indoor dining, just because, again, the ventilation doesn't tend to be as good as it is outside. And so it's still at the level that we are in the state, it's still best to do takeout and not necessarily do indoor dining. So when a lot of the counties in Georgia tend to be, there's like the yellow, the orange, and the red. So the yellow is the like lower, sort of like mild. Orange is moderate and red is severe. And so really for most of Georgia is either red or orange. And so really the opening up for indoor dining should be more when we're in around like a yellow sort of like zoning, which we're not. And so still it's ideal to try to avoid, even though, again, it's very challenging because I know we hear some of the things from our leader, and a lot of people obviously rely on that for economic stability, but it is something that you can still contribute and you can still go get takeout, but it's just best for you right now. We all love to go out to eat. We all like to, it's like, I know I empathize because it's one of my favorite social activities, but I think right now it's just not a good time.
Yeah, no, that makes sense. We'll be back in the restaurant sooner if we all do our part now. That makes sense. So we have a question from the chat box. Is it safe to be outside around other people at a distance of 6+ feet without a mask? Or should I be wearing my mask outside just as much as inside?
So if you are 6 feet apart and it's an area there's not that many groups of less than 10, it's particularly because it's hard in the summer to wear a mask. You can stay sort of 6 feet apart with a smaller gathering group and then remove your mask for like while you're eating or while you're talking or so forth. But if it's possible to wear a mask, then that's always the safest thing.
Yeah, I imagine it's never harmful to wear the mask, but okay, so that's good.
It becomes challenging. So if at all, and if it needs to be removed, or you are, obviously it depends. Like when I am with my family, then I'm not wearing a mask if we're in our backyard. But if I'm also, with another family that I haven't met or I don't necessarily know like where they have been, then I think it is wise to, again, until we know whether they're seeing anybody else, to sort of like wear a mask.
Yeah.
And then socially.
Okay. Yeah, that makes sense. All right. So you mentioned this a little bit earlier, but the question here is it true that there is less possibility to get sick from touching a contaminated surface?
Yes. So initially there were some reports where they found that how long, like how many days after did they still detect the presence of a virus on, stainless steel versus like cardboard boxes and a lot of like different materials. And while that is true, we have to think about a little bit about how what type, like the methods or how that testing is done. And what we've seen is that even if the virus is detected, that doesn't necessarily mean that virus is alive, meaning that it can spread from person to person. And so that's why it's still important. Obviously, if something looks visibly soiled, it should be cleaned with water and soap. And then for high touch areas, as we've described, where a lot of people are going in, it's always a good idea to do the disinfection. But I think it's more important for us to wash our hands and for us to wear a mask than placing a lot of emphasis on like I have to wipe down all my groceries with like special wipes or something. It's more about just keeping our hands clean. And then, can we say that risk is 100%, like it's zero? No, but I think what we've seen is that even in the studies when they've tried to like determine if the virus was detected by some of the tests that they do in the lab, that virus was no longer alive. So meaning it's just more particles left over from the virus, but it's less likely to be the main source of how people can get it.
Yeah, okay, that makes sense. And that leads right into the next. So the next couple questions are about sanitizers. So the first one is organic or plant-derived hand sanitizer as effective as non-organic or more chemical-based sanitizers?
So unfortunately, no, it's not as effective. And the reason for that is that we need for hand sanitizer, for them to be effective, we need for them to have at least 60% alcohol. And so usually the plant-based sanitizers, they don't have that. And I recognize that, a lot of the hand sanitizers are very irritating for a lot of people, or if you're using them all day long, sort of like for you all in the teaching profession, as well as for us in the healthcare setting, it's like from doing it constant, like people's hands just get like really raw and irritated. But I think that's why it's always preferable to wash your hands with soap and water. That still can irritate your hands, but you can always try to remedy that by applying, some sort of like lotion or emollient. And then for the hand sanitizer, if you do need to use it because there's no accessible water like nearby, then you could always, try to do that as well. Like wait a little while until it dries and then apply some of the lotion. But yeah, unfortunately, a lot of the plant-based, because they don't contain alcohol, then they're just not effective at killing the virus.
Yeah. Okay. And you answered the next question. 60% alcohol is the level then that a sanitizer needs to be effective.
Yeah, and I think one thing to also kind of like reinforce is that one should not make our own hand sanitizer at home, and we should not be adding, for example, I get this question often, like, well, can I just take alcohol and add it to like my own like plant-based sanitizer or another type of sanitizer? And the answer is no, and a lot has to do with the way that like chemicals interact with one another, and so it's just, mixing alcohol with other substances, it's just not a good idea. And so again, if it's not commercially available and the FDA is trying to, increase the production because there's such a scarcity around the country of the hand sanitizers. But if not, and we see it in the aisles that they're all completely gone, just soap and water.
Soap and water. All right. That keeps it simple. I like that. All right. So the last question here, or the last topic, is just general mask wearing guidelines. How do we put it on? How do we wear it over our face? In what situations should we wear them? And then who does it help? Or am I more protecting myself, or am I more protecting others?
So great question. And I'll start off with the aspect of like who it protects. And by everyone wearing a mask, the answer is basically it protects everyone. And so if I wear a mask, then if obviously if I have any symptoms or I have the virus and then I cough, and then I'll cough into a mask, so I won't necessarily give it to you, but you not wearing a mask doesn't protect me. So again, that's why everybody wearing them is just like an effort to try to keep each other safe. So that's basically everyone wearing a mask, just as simple as that. It protects both you and it protects me. And then the aspect of who should be wearing it, it's pretty much everyone. There is some for kids under 2 years old. It's not necessarily recommended that they wear a mask. Obviously, anybody, like thinking of like small little kids where they should not be having stuff in their mouth because of the hazard of choking. And then some people who have if in certain instances, if they have very like respiratory illnesses like severe asthma, or they're having an asthma attack, they should not be wearing a mask. But other than that, pretty much everyone should wear one. And I get a lot of questions about like, well, I just get like really claustrophobic, and it's really hard to like, am I not going to be able to breathe after I wear it a long time? And I know it's not comfortable, and I'll be honest, like we wear it all day long, and sometimes I just like want to like throw the mask and be done with it. But there's really there's no harm in us wearing a mask. It's not going to cause me to like breathing in my own, a lot of people ask, like, am I breathing in like toxic, my own sort of like, air, and that's not correct. It's just something that we just need to get used to. But pretty much everyone except those main groups, high risk groups that I mentioned, should not be wearing masks. And then it's really important that when we wear it, like how to wear it. And so it should always cover the nose as well as the mouth. I see a lot of like people with like the mask kind of like hanging around here, or like above the chin, or on the chin, or on the side of on the side of like hanging off the side of my ear. And so or otherwise it's not effective. It basically needs to be covering your nose and needs to be covering up to your chin. And then the other thing is, like, for people like me who wear glasses, you need to make sure that it's snug under your glasses, and you right away can tell when it's not because your eyeglasses get all like fogged. And so that's sort of like a good way to know if you're wearing it like properly. Make sure that it's sort of like snug around the nose so that a lot of that air is being contained really within the mask.
Yeah. And I've noticed especially with some of the younger kids that we work with, some of the masks are just too big, and so they end up leaving a little gap here on the side. Do they just need a smaller mask, or is that okay? It just looks funny, or?
So yeah, that they probably either need a small mask, and I know this is again just more like a surgical mask, but there is that little trick that you can kind of like tie it for people who have like small faces, and even for those, so that it creates more of a snug fit, so making it like smaller on the side, so then it no longer sort of like pouches out.
Yeah.
And then they do have some of the masks. I know they're not I don't think they're very easy to find, so I'm a little hesitant to say that. There are some like little masks that have, especially for kids, that have like a little almost like clip down here where you can kind of like make it bigger, make it smaller. But the easy way, and I do that with my son, I just basically like tie it. And then that in a way, if I can't get a different mask, then that just sort of, helps with that little out pouch where the air can kind of go out.
Yeah. Okay. Thank you.
And I think cloth masks are, obviously, they will do the job. There's some people that wear bandanas, and there's some studies that bandanas are not as good as the other cloth masks, and they may have to do with like fit and them kind of like falling down when you like tie them. But the surgical, it's not necessary for people just in their daily life to wear surgical masks. A cloth mask will do, and it's and then those other ones, the N95s, which are more like the higher grade, or the ones that they sell at some of the like Home Depot or Lowe's, that are more like the construction masks. Like those really should not be used by most people. Those should be reserved more for like the healthcare setting or higher risk sort of populations.
Yeah, that makes sense. Now we do, for anyone listening, we do have masks available for sale at cornersoutreach.org. We've hired some of the moms of our after-school program who had sewing experience, and they've been working hard for the last couple months putting masks together. And so the money that we make from those masks goes right back to paying those moms who lost their jobs when the pandemic started. And so if anyone's looking for extra masks, we've got plenty of different colors and styles, and I've got mine right here. But yeah, it's a good way to support the community and also get that other mask, because like you said earlier, we really should be wearing them once and washing them. So we need a couple to rotate. Let's see. We've got one more question coming through the chat box here. With the flu season coming, this is going to be a good question. What are your recommendations? Should we get a flu shot? And will getting the flu increase the possibility of getting COVID-19?
So that's a really, really good question. And I think all of us are, very, heightened or alarmed in a way by what may happen this coming season. But I think it's more important than ever to get a flu vaccine. And that again, we don't have as much experience, obviously, knowing, or much information of knowing like how people will fare if they get both the flu as well as COVID. But there are some reports from last year that having the presence of those two infections at the same time could make the severity of illness, or I guess make the illness more severe. And so it is important to get a flu shot. And also because, if one has influenza, then even though the Tamiflu, which is what we tend to give, it may not be perfect and the best medication, it is something that we can offer. So it is certainly important to try to get your flu shot, so that even if you do, and to try to prevent as much as possible, having that as well.
Yeah, that's a really good question and a really good answer, because I found myself thinking that just yesterday, like, oh yeah, I don't, like, how to navigate
Yeah.
dealing with both of those at the same time. So
yeah, it's going to be very, very challenging, and for all the parents out there, it's really important for everyone to keep up with the the vaccinations, like the scheduled vaccinations for their kids, because remember, obviously, all of our attention in a way seems to be focused on COVID, but the other viruses and the other bacteria don't care that we are focused on COVID, and so not vaccinating our children, we can still do a lot to prevent them and keep them healthy by continuing to do those measures that we've been doing for years. So, please be on top of keeping with your pediatricians or family doctors to make sure that they continue to keep on track with those vaccination schedules.
Thank you. All right. Well, our time's just about up here. Thank you so much again for coming and sharing your knowledge with us. It's hard to navigate, how we balance, our lives with being safe, being responsible, but also not wanting to just totally lock ourselves up in our rooms. And people need to go to work and they need to go to school. So we're just trying to find a way to responsibly go through life like that. So before you go and before we sign off, we'll just give you an open mic here. You can share, maybe just some of your personal experience, how you've, gotten through the mental challenges and the social challenges that have been put on you and on all of us with this situation.
Yeah, so I think one thing, that I, even on days when things don't seem very optimistic or bright, I think the thing that I always come back to is seeing what happens on a community level and seeing how the community has really, risen to the challenge in terms of like protecting each other. And I'm very humbled to see how both like my colleagues and in the healthcare setting, as well as all of the essential workers, so people in the food industry, people in the supermarkets, all of those people that really, we really owe a lot of gratitude to them. I think they are the real heroes, and they have been striving to allow us to have, to continue to have those essential services and like food and on our tables and so forth. So I think just that, and then the amount of like volunteers that have worked to sort of like what you were mentioning about your moms, that they have started to make masks, and just people being creative and people trying to like protect each other. So I think in the end, particularly in times when we may not have very clear leadership from our political leaders, I think it's been very humbling and just gives me a lot of like a ray of sunlight in these dark times that people, what we can do as on an individual level really makes a difference. And it has been just very heartwarming to see that come to play in many different aspects.
Yeah, that's a really good reminder. Thank you. All right. So thank you so much again for joining us, Dr. Paulina. And thank you all for listening and for joining us. If you have additional questions, you can reach out to us by commenting on this video, and we'll be able to email Dr. Paulina or other experts and be able to answer those questions as they come. And again, if you'd like to buy a mask, you can go to cornersoutreach.org and you can see the banner, More Than a Mask. These are local moms here in Norcross who are using their time and their talents to make these masks, and they're a lot of fun varieties and styles. And as we've heard today, they obviously show how much we can care and support each other by protecting each other. And there's also youth sizes available. So if you've got a kid with the pouching mask, you can get a small enough one for them. So thank you again, Dr. Paulina, and thank you all for listening.
Thank you, everyone. Be safe. Wear your mask.